Here, look, could I share time half and half with Senator Annie Hoey?
That agreed.
Thank you, and I'd like to thank you very much, Minister, for coming into this House at such short notice in response to our amendment on the order of business this morning. We do appreciate it, and I do welcome you here and commend you on your appointment. Well deserved, and it's been a pleasure always to listen to you in this House on previous occasions too, in a different role. I just want to briefly express again our support for the residents in the Carsavine Centre, as expressed by my colleague Senator Hoey yesterday and Senator Wall as well this morning. And indeed, when the news came out about the appalling conditions in which the Carsavine residents were living, I wrote to you yesterday, Minister, and to your colleague Minister O'Gorman to express concern and to ask that these be addressed urgently. And I'm glad to hear from your speech that actions are being taken urgently to address those. In terms of direct provision more generally, as we know, it was introduced originally as an ad hoc, somewhat temporary system. It has, of course, morphed into a system in which we've seen really serious problems, really serious injustices occurring, in particular a number of areas. And again, like many others, I visited centres and spoken with those in there. First of all, it was a system that was never suitable for families with children. It was a system that was never suitable for people who wanted to do their own cooking, because there was no facility for people to cook. As we know, self-catering has only come in much more recently as facilities, and this is a real problem. The long waits in the system, and again a serious problem for a system of accommodation that was originally intended just to be a short term. And finally, the grudging way in which the state approached the right to work, by denying it initially and only grudgingly, as I say, introducing it following a court action. And we're an outlier in terms of other jurisdictions. Other jurisdictions do grant asylum seekers a right to work. So just to be clear, how we measure up. So I do very much welcome the commitment in the programme for government to replace direct provision, to abolish it, to end it, as we've called for in Labour, and to replace it with a new international protection system based on a not-for-profit approach. That is the right way to go. I'm glad that Catherine Day's expert group is looking into best practice elsewhere to see how we can learn from that, and it's good to hear that her report is due at the end of September and a white paper due by the end of December. We accept it can't be done overnight, and we accept there must be a proper system, a proper adequate system to replace direct provision. But we are going to be holding you, Minister, and your department, and indeed your colleagues, Minister O'Gorman, who will be taking this over. We will be holding you to account and to ensure that the system is abolished and that we see Ireland returning to become an Ireland of the welcomes, as it should have been, and indeed as it was intended to be. And others have spoken very eloquently about the positive contribution that those from other countries make in our country, and I think we need to bear that in mind. And I'm very heartened by your comments about that.
Thank you. Senator Hoey.
So, thank you, Minister, for coming here today, and I look forward to the work that both your department and Minister O'Gorman's will be doing on this issue. I'm going to talk specifically about the Carsavine situation and use as many of the words from the people who are there themselves. In their own words, the people in Carsavine are already victims of trauma, including torture and rape. There are over 100 residents in a 56-room hotel, and it has been known since April that this accommodation was unsuitable. Even outside of a global pandemic, sharing rooms and non-family members is not suitable, and we have evidence here from a number of people that stated in April that this was not suitable accommodation. Dr. Tony Houlihan himself said it was not possible to observe social distancing, sharing rooms with people who are not part of your family. Since then, there have been 23 confirmed cases of coronavirus, including one child. And I'd ask those of you here to think for a moment what that is like, to flee from a country, to experience torture, rape, to be terrified, frightened out of your life, and to be put at the ends of Ireland into a hotel, mixing with people you don't know, and there was a virus spreading through, and people are getting sicker and sicker in the accommodation that you are in. That is not the island of 1,000 welcomes that we promised that we are supposed to be. Since your announcement that you were going to be in here today, I very quickly took the time to speak to MASI, the Movement of Asylum Seekers in Ireland. I spoke to some of the residents who are down in Carsavine working with the people in the centre, and I spoke through them to a resident themselves. And here's what they want you to hear. First of all, MASI, when I spoke to them, were on their way down there, and and I've since got a message to say that they were not allowed into the Direct Provision Centre to talk to the residents. So I want to know, Minister, why Massey is not being allowed to talk to residents when they are the people who advocate most for them. They also want to know, will you intervene, Minister, and listen to the residents who are traumatised over the past few months and including the past few years of what they've experienced? From the residents of the Skellig Star statement, which has gone around, and I'm sure you've already seen that. Minister, will you ensure access to a social worker in order to have their health catered for and monitored regularly? And will you transfer the residents to an appropriate accommodation centre, suggested Tullamore or Mosney, where proper vulnerability assessment and adequate treatment for trauma can be taken? And Minister, can I also ask, when your officials went down, why they would only speak to one resident and refuse to speak to the residents as a group? The residents do not want to be separated. They want to speak as a group because they fear what will happen to them if they are separated. And Minister, I just want to talk about the context of the issue. There is currently 41 residents left there. 30 residents have left. Do we know what's happened to those residents? Where are they? Are they out on the streets where they perceive it to be safer for them than staying in the Carsavine Centre? And what exactly are you going to do about those 30 residents? Minister, immediate action must be taken. I have a quote here from a resident who gave to me a few minutes ago. They should understand the emergency of our situation. Hence, we have gone for so serious a step of a hunger strike. This is not something to leisurely discuss for days. Immediate action must be taken. And Minister, I ask you, what immediate action are you going to be taken? Not to close down the centre in a matter of weeks or months. It must be done in a matter of days. And your test and your department's test and the Minister for O'Gorman's test for their commitment to ending this system will be tested by how you treat the residents of Carsavine over the coming days.
Senator Garvey.